Hey guys, Dr. Mark Bowers here. Question for you. Should we or should we not evaluate for PDA? Pervasive drive for autonomy, pathological demand avoidance. Should we evaluate for it? And a lot of people say yes. Now, I know a lot of parents who help each other out definitely feel like, hey, we just have to understand our kids, and that's excellent. And absolutely, we have to understand our kids. I also know that our kids are complex. We have a lot of very challenging dynamics that go on in a neurodivergent profile, and it's not often a sort of one size fits all approach. And so that's where the evaluation comes in. One, can you find someone who is neurodiversity affirming, who is PDA affirming, or at least who understands what's happening in the PDA space at the moment? And also who understands neurodiversity in general, and somebody who is skilled and qualified to evaluate for a variety of different other presentations and profiles. And I know a lot of people think that clinical psychologists, pediatric psychologists like myself, that we want to pathologize everything. And I think that's why a lot of parents, especially dads, shy away from bringing their kids in. Maybe dad had a bad experience of his own. I often hear about dads who say, hey, I was in special education. They didn't really know what was going on with me, but they just kind of threw me into a room, and it was bad for them. And they have this traumatic response to this idea that there might be something going on with their child. But I can also see, and I've seen this a ton lately, especially among my Gen X dads. All right, guys, starting to really take a look inward and really start to say, hey, as I'm watching my child grow up with all of his or her neurodiversity, I'm really recognizing in myself that there's a lot of that going on too. And so now I am having parents ask if after I evaluate their child, can I evaluate them? And absolutely, we can help in any way, shape, or form to promote understanding. And so many dads, especially, who get that knowledge, it's like a tremendous relief that can enhance relationships with their significant others. It can improve things at work, and especially improve the parent-child dynamic. And we can get away from these power differentials, and whether it's in the PDA space or not, to connect with our kids before we try to correct any behavior. And of course, correction is not always just to control the child and overpower them and to exercise our will and our authority. No. The boundaries are necessary, guys. The boundaries are there for a reason. And yes, we can set limits with children. And yes, in the PDA space, there is more to life than only low demand approaches. And I know that, going back to dads, especially, guys, like a lot of you guys are terrified. I hear you guys. I hear you fellas, this PDA space is weird. Like, okay, you're telling me that I got to drop all demands and let my kid eat as much candy as they want and stay up as late as they want, play as many video games. And yes, you can overinterpret this idea of low demand to be absolutely zero demand if you're not careful. And then what, though? And I know a lot of people argue, well, once you go low demand, then you can sort of you get the anxiety down, so then you can increase the ability to sort of move through life. And that can be true, absolutely, but we don't yet know, again, because PDA is not formally recognized, so we don't have a really solid literature on this yet to be able to say, hey, yeah, that's exactly what this particular subtype of PDA does. Because even within PDA, we know there's going to be more subtypes, just like there was back in the old, the good old days, if you ask me, when we could actually differentiate this autism spectrum constellation. Now we could actually back in the day say, hey, no, these individuals are more what we call Asperger's syndrome. These individuals are more of a pervasive developmental delay, not otherwise specified. These individuals are going to be then more in a severe, moderate, or mild autistic disorder presentation. We had such different approaches for those different things, even within PDA, we're going to see that there's probably differences in approaches, that there are some kids that can benefit from some ABA approaches, and there are kids that need more demands, even though initially their anxiety is so intense that they freak us out and they convince us that they need low demand, and everything in between. But guys, we've got a lot going on here other than just the ASD, PDA. Maybe we have we've got the ADHD. Maybe we may have aggression and destruction. For you dads out there, these labels are designed to open up a door, right? These sort of label to enable, but it's, the label is just something that a professional is going to use to sort of make sense of a situation and to sort of understand and maybe accommodate a situation, right? So the label shouldn't create more challenges for the individual. It helps us to recognize why there are challenges for the individual and express and explain that to the world, and also in our own parenting to know what exactly is happening for this individual, because I don't want to inadvertently recommend something, or as a parent myself, I don't want to do something that's going to create more problems for my child. And if I find myself beginning to sort of turn on a significant other and believe that maybe their approach is the reason why the child is this way, or we maybe had the control that we needed when our child was younger and our child was before they went to school age and left us to go into a different environment, and we were able to accommodate and be flexible on their behalf when we send them to school. And I'm seeing a high number of individuals in this sort of 3, 4, 5-year-old range who are being asked to leave preschools because their behaviors, right, are so out of the norm or the expectation of what's appropriate, that it's so destructive or disruptive that there's just no way that the staff that are in this environment have the resources necessary to be able to support. And so then where do we find ourselves, right? In this sort of loop where then we get sort of homebound. And then if you're a family that doesn't want to necessarily hunker down and do the homeschool approach, and you want to work through some different approaches, then you need to find clinicians and individuals who can help you with that. So feel free to give us a shout if you guys need anything, and I'll field anything that you guys have on your mind. But just wanted to especially send a shout out to some dads out there, but also just in general, for individuals who are out there really just trying to understand their child. A really thorough and in-depth evaluation can look at so many different variables for you so that you understand exactly what's going on. There's so many different variables that we can approach there. So hopefully this information is helpful. Take care, everybody.